Mark Consuelos revealed that he's not particularly fond of a cosmetic treatment his wife, Kelly Ripa, undergoes. The talk show host gets masseter Botox to relieve her jaw tension and stop her grinding her teeth at night. The topic arose during a recent episode of Live with Kelly and Mark, where the couple were joined by Criminal Minds actor Adam Rodriguez. The trio discussed Adam's struggle with teeth grinding, to which Kelly offered her advice. "I'm going to fix this for you. I'm going to fix your problem," she said. "Botox in your jaw. Yes, that will stop you from grinding your teeth. You will not be able to grind. You won't be able to smile or do anything else," added Mark, before playfully pulling a limp expression. "I smile and I chew all the time," replied Kelly. "Yeah, but the first couple of days," said Mark. Despite the laughter from the audience, Kelly warned her husband about the consequences of his cheeky dig. "Just remember this statement tonight when you start rubbing up against me," she said. "I don't want to have a debate like, 'What's wrong? What's the matter? Why are you ignoring me?' I'll be like, 'My jaw can't move,'" she added before Mark proceeded to introduce the commercial break. "All right, we need to take a break," he said. Botox, botulinum toxin A, works by blocking the signals that cause the jaw muscles to contract. While the masseter muscle is essential for chewing, it can sometimes become overdeveloped, leading to jaw clenching. This can result in a bulky appearance of the lower part of the face and symptoms such as headaches and jaw pain, commonly known as temporomandibular disorder. Aesthetic doctor Dr. Asha Chia previously told us. Muscle-relaxing injections are effective in slimming the face, but only if the masseter muscle is overdeveloped. If you clench your teeth and notice these muscles become more visible, muscle-relaxing injections treatment could help, shared Dr. Asha. Typically, masseter Botox can last from 4 to 6 months, aesthetic doctor Dr. Wasim Taktuk previously explained to us. This depends on the individual. Some can feel the benefits for a little longer. Treatment costs will vary between clinics, but they can range between £150 to £500. Kelly previously revealed that her dentist recommended the treatment as she was a real teeth clencher who would grind her teeth at night. During an episode of the show in June last year, Mark teased his wife over her amusing appearance when she turns the lights out. "You have so many things going on in your mouth," he said. "You've got your retainer, you've got the little band, the thing. Do you have upper and lower retainers?" The blonde beauty then admitted that the retainer was given to her by her dentist. "I was a tooth grinder," she shared. "Got Botox in my jaw because my dentist recommended it, and it's changed my life. It's changed my life." She continued, "I was a real teeth clencher. I clench my teeth because I don't want what I'm thinking to come spilling out of my mouth." Mark offered the audience some insight into the condition and shared that tooth grinding can cause tooth wear. You grind your teeth down. It gives you jaw pain, muscle pain. There are few places where marriage, medicine, and morning show banter collide, quite like the set of a live morning television program. On a recent episode of a familiar show, a lighthearted conversation about teeth grinding, a surprisingly common dental complaint, turned into a moment of gentle ribbing between spouses that had the studio laughing and gave viewers a glimpse of how two very public personalities negotiate humor, health, and the small tensions of shared domestic life. Kelly, who has spoken openly before about her dentist-recommended treatment for nocturnal tooth grinding, explained with the frankness viewers have come to expect that masseter region Botox change her nights. The treatment, administered into the jaw muscle to relax it, reduce clenching, and protect teeth, is a routine procedure in many aesthetic and dental practices. She described it as a practical fix. Less jaw pain, fewer headaches, and a softer, slimmer jawline when the muscle is overdeveloped from chronic clenching. To anyone who has ever woken a partner up with the sound of grinding enamel in the night, the appeal is obvious: relief, protection, and in some cases, cosmetic slimming. Enter Mark, quick with a quip, playful, and not above dramatizing the downsides for laughs. When Kelly cheerfully offered a fellow guest the same fix, a generous, I'm going to fix this for you." Mark couldn't resist pointing out the trade-offs. "You won't be able to smile or do anything else," he teased, and then pulled a deliberately slack expression that sent the audience into a ripple of laughter. It was a classic couple moment, one partner extolling the virtues of a medically recommended treatment, the other puncturing the solemnity with teasing alarm. What made the exchange memorable wasn't just the joke, but the way both partners used the moment to reveal a little more about themselves. Kelly, always quick with a comeback, warned Mark that his teasing might have consequences, not medically, but relationally. "Just remember this statement tonight when you start rubbing up against me," she shot back with mock severity, conjuring an image of affectionate late-night closeness thwarted by temporary jaw stiffness. Mark played his part, and the pair moved to commercial with the easy chemistry that has made them television fixtures. Beyond the glitter of a studio exchange, there's a human story about coping with the small but stubborn medical annoyances that many people live with. Teeth grinding or bruxism is often dismissed as a minor problem, a nervous habit, an embarrassing thing you hope your partner doesn't notice, but it can cause real damage over time. Dentists warn of tooth wear, fractures, and temporomandibular joint pain. For some, a retainer or mouthguard does the trick. For others, when muscle overdevelopment or persistent clenching is involved, targeted injections to relax the masseter muscle can be recommended. Doctors who spoke previously to media outlets explained that these injections work by blocking the nerve signals that cause the muscle to contract, an effective temporary fix that typically lasts several months. The practical details of such treatments were part of the conversation off camera and in coverage afterward. Masseter Botox is not intended to permanently remove chewing ability. Rather, it reduces the force of clenching enough to protect the teeth and ease pain. Depending on the patient, effects can last around 4 to 6 months, sometimes longer. Cost varies widely by geography and clinic, but most places price the procedure within a range that makes it accessible to many who are motivated by pain relief or dental preservation. For figures accustomed to being in front of cameras, the cosmetic side benefit, a softer jawline if overactive muscles have given the lower face a bulky look, is often treated as a secondary perk. There's also a candid psychological layer here. Kelly's admission that she used to clench because she didn't want what she was thinking to come spilling out gives the audience a moment of intimacy. It's simultaneously funny and sharp. Many people clench while sleeping for reasons that go beyond simple stress. Misaligned bites, certain medications, or sleep-disordered breathing can contribute. Talking about it in public, especially with the levity of a late-morning segment, helps normalize seeking treatment for things most folks quietly endure. Mark's role as the mock-concerned spouse is classic and human. He's not actually opposed to the treatment. His joke is performative, a small attempt to reclaim the comedic upper hand. Yet his line, "I smile and I chew all the time," points to a real, if temporary, trade-off people consider when taking action on their bodies. For others watching, the exchange might echo a private conversation. Do you go ahead with a treatment that alters a familiar part of you for the sake of less pain or better health? How do couples tease and negotiate consent around such choices? The studio laughter was also a collective exhale, an acknowledgement that health decisions in relationships are rarely made in a vacuum. The guest who sparked the chat, an actor known for a long-running procedural drama, had been sharing his own history with grinding. The empathy in the conversation underscored how common the condition is across ages and professions, even among performers accustomed to tight schedules, late nights, and the stress that can accumulate. It also highlighted a practical, cross-disciplinary point. Dentists and aesthetic doctors sometimes find themselves recommending overlapping solutions. For some patients, a dentist's retainer is first line. For others, giving the jaw muscle space and rest requires intervention. The result is rarely theatrical. For many people, it is quietly life-changing. Medical experts who have publicly commented on the procedure describe a careful, conservative approach. Not every person who grinds their teeth needs Botox in the masseter. The treatment is most effective when the masseter muscle itself is visibly overdeveloped or when clenching is persistent and causes pain. Assessments typically involve dental professionals and, when necessary, aesthetic practitioners who understand facial musculature and function. The procedure is relatively quick, and side effects are usually mild. Some patients report transient changes in bite feel or chewing force for a few days until the muscles settle. The stakes increase when